My name is Louise Square, and I'm the Health Equity Coordinator for the New York State Department of Health AIDS Institute. I'll be your moderator for the evening. We'll just do a quick overview of what the hour will look like. Next slide, please. So we'll have our welcome and housekeeping tips, and then some opening remarks. Then we'll have a panel discussion with questions, audience, and a closing statement, and a thank you to our panelists. Next slide, please. So our housekeeping. To ask a question, thank you to those who have submitted a question in advance. We will address as many questions as we can within the time constraints of the program. But to submit a question during the program, please email COVID-19Vaccine Equity at health.ny.gov. Next slide, please. Now we'll have our opening remarks from Mayor Mark Morial, the President and CEO of the National Urban League.
Thank you very much. And it's so good to be with everyone. I want to thank all of the people who have organized this event for their foresight and care and diligence in ensuring that this will be a very productive 1 hour. I secondly want to thank the panelists who've agreed to join, especially Dr. Franklin Richardson. And I want to congratulate Dr. Richardson on his new book, Witness to Grace, which of course is a must read. Dr. Richardson, you and I have the great similarity of both having released a book as COVID dawned. My book, The Gumbo Coalition, came out last May after COVID had dawned. Let me just say a few things to begin the discussion. A little less than a year ago, as COVID just hit the news, I was at one of my son's high school basketball games. And a parent who's a friend walked up to me and said, "Have you heard about COVID?" I said, "Sure have." He said, "Did you know that Black people are immune from COVID?" I said, "Black people are immune from COVID?" He says, "Yes." He says, "I read it on the internet today. It's absolutely true." And I said, "Well, how can we be immune from COVID?" He said, "It has something to do with melanin. But trust me, we're immune from COVID." It didn't make sense to me, but I tucked it away. As deaths began to occur, as hospitalizations began to increase, as offices began to close down and travel began to be curtailed, someone I know told me that the emergency rooms at a number of hospitals, both in New York City and in my beloved hometown of New Orleans, were overrun with Black people and other people of color. As I watched the news and went to the Johns Hopkins University website, I saw no information on the racial breakdown of who was dying, who was being infected. I saw nothing but aggregate numbers. My team and I at the National Urban League decided we would quickly put two and two together. That is what we sensed and what we heard, and immediately began to publicly demand that states and hospitals and others release disaggregated data on this pandemic. Lo and behold, when the state of Louisiana, I believe, became the first state to release disaggregated data, we saw the hard reality that we all understand and know today, that Black people were twice as likely to die and far more likely to be infected with severe cases of COVID. And thus this disparity in healthcare, this idea of healthcare deserts, this idea of the medically underserved, became less of a discussion that we have in equity and civil rights communities and more of an understood reality by so many. Where we are today, a year later, hundreds of thousands of deaths later, loved ones, family members, and friends. Both my wife and I suffered from a bout of COVID early in the pandemic. We have friends and family members of friends who've lost their lives. Our voices, our advocacy has to be loud, strong, and continuous to ensure that the actions being taken now make this vaccine equitably available to all, and that people in Black communities, brown communities, and Indigenous and Native American communities across this nation, number one, that the trust is understood, but that there is a commitment to help build trust and provide information and access, so that we can get this vaccine. What does that mean? From the very beginning, in November of this year, Governor Cuomo called me at 7:15 in the morning on a Sunday at my house and said to me, I have just gotten some information through the National Governors Association that the plan to distribute the vaccine is going to primarily rely on pharmacies and hospitals. He says, doesn't sound right to me. Does that sound right to you? I said, of course not. You have to distribute the vaccine in the community, at the churches, at the schools, at the libraries, at the community centers, where people are. And thus my involvement in vaccine equity as a member of task forces here in New York and the National Urban League's voice on the national stage about vaccine equity accelerated. Today, as this panel discussion indeed takes place, the answer is simple. Number one, we need investments in community education and public engagement so that people in our community have information, they understand how the vaccine was made, who participated in the process, that the process was devoid of politics and was a process based on science and medical integrity. And with that information, I'm confident that many people will be trusting enough to take this vaccine. Secondly, we can't talk about hesitancy if the place where the vaccine is administered is halfway across the other side of town and it requires a bus ride or a subway ride or a drive or a Uber or a jitney or a Lyft or a... No, we have to bring this vaccine into the community. This week, the beginning of these mass vaccine sites at Medgar Evers College and in Queens and New York City and at a number of places around the nation, I think represents the beginning and a good beginning on bringing this vaccine closely to people. The final thing I'll say is tragedies, crises, human pain and suffering are often wake-up calls. Once again, we are receiving a wake-up call on disparities and systemic racism and unfair treatment in the healthcare systems. If the states and the nation are going to pour money into rebuilding the healthcare infrastructure together. Let's build it back differently. Let's not just repair Humpty Dumpty. We got to build a new Humpty and Mary Dumpty. We have to build a new healthcare system that is equitable and fair. So thank you for the efforts in New York to elevate vaccine equity. And certainly I want to thank you for the panelists. They are quite knowledgeable and passionate. And I appreciate all of you listening to me today. Have a good evening.
Thank you, Mayor Mario, and thank you for our marching orders and some clear direction on how we should move forward with vaccine equity. So next slide, please. Oh, introducing the panelists. Yes. I'm excited for this opportunity to have this discussion with three highly respected leaders from our communities of faith. All of our distinguished guests have extensive and impressive bios, so we condense them for the sake of time. First, let me introduce Dr. W. Franklin Richardson. He presides over the thriving historical Grace Baptist Church as senior pastor. Dr. Richardson presides over 3 locations with more than 4,000 members in New York and nationally. He has preached across the world and served on various committees, including the Central Committee of the World Council of Churches. Dr. Richardson is an active board member and serves as a board chairman for the National Action Network Conference of National Black Churches and Virginia Union University. Dr. Richardson is an author and bestseller of Witness to Grace, A Testimony of Favor. He formerly served as a director for the Pepsi-Cola Ethnic Advisory Board and Harvard University's Divinity School Summer Leadership Institute for Church-Based Community and Economic Development Initiatives. Next, Imam Abdul Rahman Yaqi. After relocating to the United States from Ghana in 1998, Imam Yaqi began graduate school in a joint program between Howard University and the School of Islamic and Social Science in Leesburg, Virginia. After his academic pursuits, Imam Yaqi has taken on various roles as a religious leader. He is currently the senior imam at the Islamic Center of the Capital District and a chaplain for the Washington Correctional Facility in Comstock, New York. In 2018, Imam Yaqi published his first book, An Introduction to Islamic Marital Counseling. Imam Yaqi serves on Governor Cuomo's Interfaith Advisory Council, and he is an ambassador for the COVID-19 Vaccine Equity Task Force. Dr. Salvador Sabino. In 1990, Dr. Salvador Sabino and his wife founded Heavenly Vision Christian Center, which has a reach of more than 1,200 worshipers. Heavenly Vision Christian Center has expanded its reach with churches in North and South Bronx, Manhattan, Long Island, Connecticut, Orlando, and Palm Beach, Florida, and the Dominican Republic. Most recently, Bishop Sal Sabino was promoted to the board of directors of Radio Vision Cristiana International, which is the largest Spanish radio ministry in the world. Currently, a motion picture is in the works based on his life, which has also been shared in the book titled Two Ways, or Dos Caminos in Spanish. I'd like to thank all of you for being here. During our conversation, we plan to talk about the information many of us still need to make an informed decision, including exploring the historical context and the science behind the COVID-19 vaccine. We're inviting our guests to share their knowledge as well as their experiences. Most importantly, we want to share information with all of our participants that will help them in their decision-making processes. We only have a short time, so we're going to jump right into the questions. Again, welcome. Our first question, is about how has COVID-19 impacted you, your congregations, other congregations that you may worship with, and the communities that you interact with? Let's start with Dr. Richardson.
Thank you, Louise. Let me say that I think COVID turned everything upside down. We had to re-navigate our arrangements. The fears came flooding in our communities. Our churches found themselves in a whole new space of how and what and where to have worship. We found our people devastated by the statistics, especially in New York, by the statistics that were coming, the funeral homes that were overflowing, the cemeteries that were flooded out, the numbers of people who were sick, the lack of knowledge, the lack of knowing what was going on. It was a dark season in the life of our communities. And it was a time when the church had to figure it out, and pastors have had to figure it out. And I think some churches have been so challenged that they've not been able to continue their ministries, while others have cut their ministries down. And it's still a devastating reality in our communities. However, let me say that I think faith has found new birth in the midst of this tumultuous time, that faith has gotten stronger, that spirituality has expanded, and a focus on our own vulnerabilities have caused us to come face to face with our own spirituality and mortality.
Thank you, Dr. Richardson. Imam Yaki?
Thank you, Luis. Bismillah ar-Rahman ar-Rahim. In the name of God, the Beneficent, the Merciful. I begin with the attitude of gratitude, first thanking the Almighty God and also thanking our governor for such a very difficult time and assembling great minds and experts during this difficult and challenging time. Likewise, our frontline workers, and to you all, thank you very much. Well, Secretary Gardner once said, if you complain about the state of the world and aren't at work on some piece of the agenda, you are part of the problem. Now, since we are here, part of the solution, definitely we have to be patient and do it together. Now, pertaining to the question, the impact is unimaginable. Now, when you look at the nature of the Islamic prayers, shoulder to shoulder, bowing, prostrating, and in some instances, after the prayer, shaking hands, hugging, and in some situations, socialization. And now all that, we could no more do it. And CDC identify some of these actions as high risk. Therefore, we have to find a new way, as the doctor did mention earlier, regarding our worship participation, but adhering to CDC or New York State health rules. Not easy at all. How do you convince all to pray 6 feet apart? 2, how do you convince them to register before coming to Friday Juma services? And I remember very well, one day I came out and I have probably around 20 people. I have to tell them, I'm sorry. Have you registered? They said, no. I said, I'm sorry, you have to go back home, register next week and come back. But the most difficult one is this. How do you convince a family who had lost a loved one that this funeral, only few people, and the funeral cannot happen in the mosque or place of worship? Well, these are part of the challenges that indeed we have faced. Some Islamic centers, and I know very well, some churches and synagogues are still partially closed. Most activities virtually held. Surely what we need to do is to find a new way to doing things. But remember, protecting lives takes precedence. And that is why we are here, and that is what we're doing.
Thank you so much. And Dr. Sabino, would you mind answering the question as well?
Sure. Luis, what I could say is, first and foremost, those big words pronounced before, fear and trust. We have experienced them in our particular congregations. And like you said, we are basically in the 5 boroughs except Staten Island, because we are in Brooklyn as well. And let me tell you, we have had to do multiple things in order to survive. The fear was so strong that even on that second call that we can have 50% of the congregation coming in, and my congregations are usually younger than most, people just didn't want to come because they were in fear. So I had to naturally get on the phone. I had to visit some people, bring them food, and naturally covering myself. And I did the same thing with my staff and with my leaders in ministry. And thank God, the Lord gave us the idea of celebrating multiple services at the church. So what are we doing today? We are celebrating 3 different services on Sundays, 10 a.m., 12:30, and 3 p.m. So we are impacting over 700 people. That is a little more than half of the people that we have. During the week, we also have a meat service on Tuesday nights of fire, we call it. And people are starting to come back. And Fridays, we have the youth. Now, this is a very interesting group, the youth, because just as Mark said in the beginning, in the introduction, opening statement, that we were immune as Black people to this virus. So did we say the same thing about young people, that it would not hurt young people? Well, I have bad news. Some of our young people got infected badly, but thank God no one left us yet, and we are positive. So what I could say is, let us fight fear. And fear comes out of lots of things, but fear is the biggest issue here that we have to deal with.
Thank you. Thank you so much. So you've kind of already, each one of you have kind of already touched on my next question, but as a faith leader, what do you see as your role in the New York State vaccine effort? Let's see, let's start with Imam Yaki.
Well, first and foremost, understand, then be understood. Of course, the office of the governor has given us tools for our security, and it is actually said that an individual's sense of security can be viewed as dependent on his relationships with others. So first and foremost, as leaders, understand. Then to be understood through active listening, it is a collaborative effort. The receiver is as active as the sender. Therefore, the goal again here is protecting lives through preventive measures. What we need to actually make it clear to our congregation is that, yes, I may be safe, but surely I believe my people need me. And happy people are givers. Therefore, give and you shall be given. How much?
Yes.
Sometimes what is being said is that, Imam, how much did Pfizer pay you to be doing all this? And I said, well, congratulations. We both are being paid. And guess who pays? The Lord, the creator of all. Giving a life to one person is as if protecting the entire humanity. Taking an innocent life is as taking the lives of the entire humanity. So our goal is, yes, let's do this, because when we are able to save one life, we have saved all. And that is the goal here.
Thank you so much. Pastor Sabino, did you want to respond to that as well?
Sure. When I was talking about fear, a lot of people were even expecting the vaccine, and they were doing so negatively, saying this vaccine has been created too fast or whatnot. But lately, things have been changing. Okay, I got vaccinated myself, and I told the congregation. So now we are planning to use the church as a vaccine center, a vaccine site, just like we did when COVID first came out. We joined SOMOS by the governor, who gracefully sent them to us, and we were distributing masks and testing people all summer long. And we praise God for that. Now, I want to tell people that vaccine will definitely keep us healthy. Vaccines are as important to our overall health as exercising and dieting. Sometimes the news works against us, against the preachers. Why? Because some of the commentators, they have their own opinion. And guess what? They are like the most heard. And they start talking, oh, this is too fast. Vaccines are not going to work right. And da 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 da. So we are fighting that. But all to this day, I'm pretty sure that people minds are going to change and that most will get vaccinated. So once that happens, once we start vaccinating everybody, and I pray that we make it easier for everybody, because Mark did talk about that as well, saying that if we have to commute, if we have to hop on the train, take a cab or whatever, it's not the same as bringing the vaccine to the people. So if we keep doing that and we work on that, I'm pretty sure that things are going to change.
Thank you so much. Dr. Richardson, I'm going to give you a little spin to the question. Have you created a sermon or had a meeting with your congregation about the vaccine? And if so, what are some of the initiatives at houses of worship that have been implemented to get information out about the vaccine? Dr. Richardson, you're on mute.
First of all, the vaccine required me to redefine my own expectation of my role because it required a different approach. I no longer had the ability, we shut our church down in March. And so immediately we began to expand what we already had in place was live streaming. Today, we now have all of our activities that are live streamed either by Zoom or we built a studio in the church so we could continue reaching people. I'm happy to tell you that our congregation's reach increased and our membership increased during the pandemic. We have activities going on all the time. So it changed my whole approach to ministry. I had to operate in a place where I was once person to person, and now I had to figure out mass ways to reach people. That required me the sermons that I preached during the heart of the pandemic were all about the pandemic, directly or indirectly, because they spoke to what people were going through. People were they were looking for questions from God. They were looking for hope in the midst of all the despair. They were looking, Pastor, is there some way we're going to get through this? What, how, and where will it? So I had to finish my time and put my time in trying to have a word for the conditions that people were experiencing. And then we also had, on a weekly basis, I have a doctor's ministry in the church made up of a group of physicians. And they met every week, still meet now, online. And they have a panel and they're answering questions all the time, telling our people about what the concerns that they had. And I would also add to what Bishop Semenio said, it's interesting that when this first started, I'm happy to tell you that the resistance to taking the vaccine was worse in the Black community than it has become. We've seen, because of leadership and trusted voices and congregations and pastors taking it head on, I have seen an increase in the willingness in our community to receive the vaccines. We as a church was a testing site where, because of the governor, we had a testing site, and we also recently gave out vaccines to the community. I really need to pause here and say, we've had an extraordinary functioning governor in the midst of this situation. And sometimes being in a leadership position, you get all kinds of critiques. But at the bottom line, many lives were saved in this state because of the way the governor approached this and was inclusive and transparent. All of us saw and heard, and he reached out for all of us. And our churches, those of us who are on this call today, we're here because I'm a member of the executive task force for restricting the virus. So it's been a real adventure to figure out how are you faithful to the calling and the responsibilities that you have as a pastor. And we continue to provide information. We got to get information, get truth out, not just the truth of the Bible, but the truth of what can happen medically. And so God has shown up not only in the scriptures, but God has shown up in our existential experience, in the here and now. And we as pastors and people of faith have to interpret the circumstances to the times so that we can save our people.
Thank you. Thank you. You've obviously launched some great initiatives. Are there others that want to chime in about some of the initiatives that have been launched because of the pandemic within your churches and your congregations?
Yes, actually, Islamic Center of the Capital District here in Albany, we had few meetings with my leadership, and not only that, but also imams of major mosques in Albany. We met and encouraged one another to support the vaccination process. And when it comes to sort of lectures and sermons, we have a lot of sermons, and I did send you some of it. We have a lot of sermons about concentrating on how do we do this right. We have even, my community has even accepted that Islamic Center should be a vaccination center, and I'm still actually waiting for the governor to okay it. I know Dr. Richardson have this okayed, but perhaps maybe in the near future that would also come to our facility here in Albany.
Thank you. Thank you. Pastor Sabino?
Yes, Luis, some people just thought that by being vaccinated, you were going to catch the disease. And vaccines won't give you the disease that they are designated to prevent. In other words, when you get vaccinated, whether it be for COVID or for yellow fever, I got an experience with that one there. The thing that happens is that you are protected because those viruses are now either dead or they are weakened. So you cannot get sick of COVID by the COVID vaccine. It's ridiculous. And we need to get out there and get that thought out, because some people are thinking, a lot of people are thinking that they are going to get sick when they get vaccinated.
You went right into my next question. Pastor Sabino, you went right into my next question, because I was going to ask, how are faith leaders incorporating the science around the vaccines and the vaccine equity into their messages? What are you telling your congregations about what you just alluded to? The speed with which it was created, the fact that you can't get the virus from the vaccines. So since you've already answered the question, I'm going to give, you've kind of already answered the question, but if you have more to add, please do. But I'm going to ask Dr. Richardson to kind of piggyback on what you just said.
The first task that I think we had as pastors and religious leaders was to verify for ourselves that we could trust the virus. I met with several, and I'm so my colleagues have as well, I met with several medical experts. I attended many conferences to get as much information as I could about the virus. I convened the doctors in our community. I talked with the mayor of our city. I involved ourselves in a education about the vaccine. And then I turned also to national trusted voices and see what they were saying. And after I did that, I felt confident that I could tell the people. And then I went and had the vaccine myself. Both, I've had two, the two of the Mondero.
Okay.
And that put me at a place where I could speak from a place of authority, a place of context. And that gave me authority, because people trust their churches. They trust their mosques.
Right.
They trust them because that's where they live. That's where they bury their dead loved ones. That's where they meet the needs of their children. That's where they marry. That's where they are baptized. That's where they come every week for spiritual nurture. So when you come home, when the church has the vaccine, and when the pastor's speaking about the vaccine, you're coming home to get the vaccine. and you trust the environment, and you trust the voice that you've been listening to all those years, because he wasn't invented the morning the vaccine was born. He's been the servant of the community across the years, and people trust him. And because they trust him, we have to be knowledgeable before we put our hands around it and endorse the vaccine. Most of us who are endorsing it, my colleagues here tonight, most of us, we have researched it, we have talked to one another, and we have come to a consensus that the vaccine is safe, and we are willing to stand on that truth.
Thank you, Dr. Richardson. Imam, did you want to weigh in on that one?
Yeah, actually, it is clearly stated Islamically, فَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنْتُمْ لَا تَعْلَمُونَ, as the people of knowledge, if you do not know. I am not a physician. However, we have doctors. I have 10% of my community are doctors, and they have helped clarify things. Not only that, but even here at the task force, we have Pfizer people coming to share with us, answering some of the questions, because some of my community members are asking, do we have animal products in the vaccine? Well, Pfizer did mention clearly that it is no. Does it cause cancer? Pfizer told us no. Does it cause infertility? Pfizer clearly states no. Well, I should embrace knowledge, because knowledge would all the time govern ignorance.
Thank you so much. And Pastor Sabino, if you want to chime in again, I can let you, but I just want to remind folks that you can submit your questions. Please see the bottom of the screen, the bottom of the slide where it says COVID-19 Vaccine Equity at health.ny.gov if you are interested in submitting a question. And Pastor Sabino, you kind of already answered this question. Did you have anything to add before we move to the next question?
Well, I was going to say that many people, even as advanced as we are, die from vaccine preventable diseases.
Yes.
And I remember when I was a child in my country, Dominican Republic, my hometown, San Pedro, in my own family, children would die, 6 months old, a year old. And when I moved to the United States of America, I noticed the difference. Children were vaccinated. Same thing here, same principle. We should trust the professionals. This vaccine is safe. I'm telling you, I got vaccinated Saturday. I didn't get a headache. I mean, some people do. I didn't get fever. Others do. I didn't get anything. And I'm totally healthy. So vaccination can mean the difference between life and death for many people. So what are we going to do? Let's preach about it. Let's instruct people on being vaccinated.
Thank you so much. So we have a question. We do have a question from the audience. Megan, do you want to read that question for us?
Sure. Hi, Louise. We had a question from our email from Garish, who mentioned that he understands that this group is focused on helping Black, Latino, and folks from other racial and ethnic minority groups. But he pointed out that we need to ensure other vulnerable populations are considered. For example, seniors who may not be comfortable with or able to get information and appointments online. He wanted to know what are some ways that we can best support our seniors to get this information and help making appointments.
Thanks, Megan. So why don't we start where we left off with Pastor Sabino, and I'll allow each of you to answer that question. If you can keep your answers concise so we can get to more questions, I appreciate it.
I believe that's a great question, Louise.
It is.
The churches, the centers, the community centers are for that. We know our communities. And we know who should get the vaccine first. We know who can wait. And we know that seniors are mostly vulnerable. It does not matter if you're white, Black, Hispanic. You need to get treatment as soon as possible if you're a senior. You are in danger. So I suggest that whoever's in power, Let us work with the community, open up the way for people to get vaccinated soon. The quicker, the better. The more lives we are going to save.
Thank you. Dr. Richardson?
Okay.
Well, I tell you,
I'm coming to you, Imam. I'm sorry.
we have the 500 vaccines we gave this week were dedicated to people over 65. And we focused on that. The demand, we have a waiting list that's twice the size of that. But we focused on over 65 under the instructions of the state. But we also had to add to that by going and picking some of them up and bringing them to the site. They didn't have the capacity to get to the site, to the church. Some of them are locked in, the snow on the ground and all the kind of problems that were inhibiting them. And so, yes, there are populations that must be addressed in a special way. I think we're beginning to do it. I think it will be no problem as we get more product, more vaccines available everywhere. I think we can reach the scope. I think the issue for us now is not our willingness nor our capacity. It is strictly getting enough vaccines so that they can be in all of the distribution centers, and so that these 3,000 points of distribution that the governor has designated in the state can be facilitated, like as my colleague Iman Rahman Yaki was saying, he's waiting for his vaccines to use his facility. There are many churches that are waiting and are willing. We've got to get the vaccines, and we will be able to vaccinate this state rather quickly if we have the vaccines.
Thank you. Imam Yaki?
Thank you very much, Dr. Richardson. But I did not pay Dr. Richardson to actually encourage that the governor's office, because right now, our seniors, the president of the institution, Zubair, and the leadership, we have suspended all elders. The elderly 65 plus are no more for the last 7 months, are not coming to the mosque at all. So if we can have the community take the responsibility of helping vaccinate it elderly, that would surely be a great, great one. So yes. Hopefully the governor's office is listening. Give that responsibility to our communities and we would execute it well. Thank you.
Thank you. So I'm going to shift just a little bit. I'm going to shift our conversation just a little bit because we've talked about it or we've alluded to it, but many marginalized communities remain hesitant, concerned, or dismissive regarding the vaccine's effectiveness and rollout for emergency use due to the historical trauma. Black and brown communities, we talk about it a lot, especially amongst ourselves, Tuskegee, forced sterilization. What concerns have you heard from your members and how have you responded to some of these things? Let's start with Dr. Richardson.
Well, let me say my communities, first of all, we are very keen to the Tuskegee experiment. But my response is to the Tuskegee experiment, number one, it was an experiment. It was not a vaccine, and it was restricted to one population. It was restricted to Black people, and Black people were cruelly mistreated by the Tuskegee experiment. However, there are no parallels between this vaccine and the Tuskegee experiment. Secondly, people have these stereotypes about the system is trying to get rid of Black people by the vaccine. Well, the issue, and I say to people, what's your alternative to the vaccine?
That's right.
The vaccine if you don't even know the outcomes of the vaccine, you know that the chances of you living better with the vaccine don't compare to you living with the virus. The virus is certain to destroy us. So therefore, that is an illogical argument. It's an illogical fear. We have all of these conspiracy theories going on in our communities that are retarding our confidence in our health and getting the things that we need. So I think it's very important that we have to disarm these conspiracy theories. We have to disarm them with truth and facts and shake people into thinking a different way about this situation. But you're right, it's in our communities. Every day you hear it, but you have to shoot it down every time you hear it, because it's an evil that is going to destroy us, to get stuck in this spot where we believe that the world is against us. You know, the truth is that we're having a hard time getting the vaccines into the Black community. So the people who are our enemies, they don't want us to take it. They're happy if we say we're going to come up with a reason not to take it. But the people who are for us understand that we've got to take it if we're going to survive.
Thank you, Dr. Richardson. Imam Yaki?
Actually, Dr. Richardson did ask, what other alternatives do we have? You know, if you are not taking the vaccine, then what? Sit down and die? No. Ours is to be hopeful. Hope is part of us. And therefore, we must be hopeful because we are doing it together. So mine to my community and the larger community, for those who are hearing here and there about all these informations, you know, look, let's do it right. And we have great leadership that is helping do it right. Be hopeful and rely on God.
Yes.
Thank you. Pastor Sabino?
Well, everyone is important. We need everyone alive. So the resistance must come down. And I believe that, like the Bible says, that my people perish for lack of knowledge. And I believe that communications such as this today with people like Imam and Dr. Richardson, I just thank God for them, that they are able to voice the opinion that creates life and that maintains life. So let us go and speak to our communities that this is the only choice right now, and it is a good choice. It is great right now. I'm pretty sure that 10, 15 years from now, we are going to look back and say, should we have gotten the vaccine a year before? You know, those lives would have been here with us today. So let us not look back. Let us look forward and let everyone be immune to this deadly disease, and let us get this vaccine together. Amen.
Thank you so much. We have another question from the audience. Megan, did you want to read that question for us?
Yep. We had a question from James W., who pointed out that many New York State residents face barriers when they're trying to get the vaccine. Lack of time off to get the appointment, lack of time off for rest after the vaccine, as well as transportation difficulties and many other barriers. He wanted to know what we can do to help people who experience these kind of barriers.
Imam Yaki, would you like to start?
Well, I believe we can do it together. This is a collaborative effort. When you try and it is not going through, say something, communicate with somebody. And if you are part of faith-based community, talk to your pastor, talk to your imam or rabbi. Perhaps we may be able to help you, but do not be quiet. Say something and something would be done.
I would also say that we all must accept the fact that this is a new experience for us.
Yep.
We have never in the history of this country had to vaccinate the entire population, or certainly 85% of the population. And that means that we're learning our way. Everybody's learning their way. Nobody knows this. Nobody's been down this road before. This is a fresh new path. And I'm happy to say I'm seeing great innovations take place. I'm seeing people step up. I'm seeing people come up. I'm seeing the science do things that they've never done before so quickly. So it's a difficult way. And we, as Iman said, we've got to be patient, work a commitment to cooperation. At the same time, we got to hold the system accountable, because we know African Americans and people of color are often the bottom. We get the last. We want to make sure that does not happen in this situation. We want to make sure that equity is observed in the distribution of the vaccine. But we also must take an event that this is not a profile that we've done before. This is brand new territory. We never had to go try to do this. And I think we're going to get it done. I'm happy to hear the leadership of the president sensitizing the nation and changing the direction. If they can get that vaccine out, I believe we're going to be all right.
Thank you. Pastor Sabino, did you want to chime in?
I definitely agree with bringing the vaccine to the people. You know, like I said, everyone is important, and we are a resilient people. We are not going to give up, and many lives are going to be saved during those weeks and months. So I'm satisfied with that. Let's keep fighting.
Thank you. We're running low on time, but I want to get one more question in. And again, we've kind of alluded to this a bit. We kind of talked a bit about it, but historically in marginalized Black, Indigenous, and people of color, we call it BIPOC communities. You know, faith-based organizations have been a source of spiritual guidance and for resources and emotional support. As BIPOC communities continue to be disproportionately more at risk of contracting COVID-19 and dying from COVID-19 compared to whites, what kind of guidance or resources can faith-based organizations offer? I know that was a big question, but basically, since our communities, our faith-based communities are trusted communities, what sort of resources can you offer to kind of keep folks from getting more information to them about getting COVID and about dying from COVID and keeping them safe?
I'd like to approach your question from this angle. We and the faith community have got to challenge the system to take this experience and use it as a way to fix what's wrong. There is an explanation why more BIPOC people are casualties in this pandemic. It is because the medical system has not been structured to service the needs of our community. Therefore, we have got to have a restructuring of medical care in the United States of America if we're going to fix the inequity problem that's not just the pandemic. The pandemic is only an expression of a systemic evil that existed before the pandemic ever came. And that was that Black and brown people do not have access in America to the resources of medical care that others have in this country. So we got to fix it there. Our churches are ready to do all we can, but our churches are not hospitals. Our churches are not science labs. Our churches are not medical facilities. But we've got to challenge medicine in the United States to be accessible to every person, no matter what their color is. And if we can't hear it in this pandemic, then we are deadly deaf as a nation. We have all the indicators that we have been mistreating African American people of color in this country. And therefore we see it. And when we pull back the scab of this pandemic, we see how disproportionate we have been served.
Thank you so much, Dr. Richardson. Imam Yaki?
Well, I believe together, let's have positive attitude. Those amongst us that are leaders and those being led. Positive attitude, especially our leadership. Now, when we are able to do that, we can help. And I'm really happy today when I heard that our president actually signed a contract with Pfizer and Moderna for, close to 200 million vaccines.
Right.
This is actually great. This is leadership. So let's do it together. Those amongst us that are leaders, be positive. And those that are being led, be positive.
Thank you. Pastor Sabino?
I think that we should go right ahead and preach faith, against fear, and tell the BIPOC communities that we are not victims, that we are a resilient people, and that this thing is going to be defeated. And thank God for the help of the government, but the church is going to do what it has got to do, and the leaders should just rise up and do what we have to do.
Thank you so much. This has been an amazing discussion. It's been hard for me not to get pulled in and chime in as a moderator. So I want to thank you, panelists, for your words of encouragement, for your guidance, for your continued leadership. I just really want to thank you for spending time with us this evening and for all the information you shared and all of the encouraging words. And I'd also like to thank the participants for being here. This was a really rich discussion, and I hope you enjoyed it. So thank you. For more information about what was shared today, please follow the link below, which we've put up throughout the night, COVID-19Vaccine.health.ny.gov. Thank you, and I hope you enjoy the rest of your evening.